So hi everyone. Obviously, we've got just around 1 week to maybe 7, 8 days to for our proper last primary days for our preparation before the NEET SS exam comes on. So at the outset itself, when we wanted to do this session, we thought that there's no magic that you can do in those last 1 week, right? Like whatever you have. Just a second. So, what you have done in the last 2 months, and even more so, what you have done in the last 2 years, that obviously counts for the most than what you will do in the next 1 week. But definitely don't go by this particular, statement or phrase that people say that the last 1 week doesn't matter. What you have done in the last, whatever your residency and your preparation days, that is the only thing that matters. That is not the case. Yes, that's a good way to go about it and to think about it the background, because that takes off the pressure a little bit. But at the same time, these last 7 days are the most important 7 days in your preparation, right? And whatever we can help you in that context, that we would like to do in this session. And I'll keep it very very short. Obviously you want to revise things, etc. And also, if you have any specific strategy related queries, then you can definitely put it in the comment box as well. So firstly, just have it in your mind how you're giving this exam. Is this your all in attempt, like you will take whatever you get, and if you don't get, then you'll consider other options, or the next INI will be your last attempt, or this is your first attempt and then like just post MD, or any which way you're just starting off your preparation journey, giving this as an exam and then basing your preparation on this exam. Whatever it is, you just have that in your mind, and based on that you have a plan for the next 1 week. So if you are someone who is going into this exam as an all-in exam, like obviously that means you have read through the last few months or even a year or so, and including your MD prep or whatever. And in that case, don't drastically change your strategy based on what I tell you, or based on what anyone tells you, because firstly you would have thought about what you will read in the last few days. You would have saved some images, saved some PDFs, saved some revision questions, whatever, or made some notes. Stick to that, stick to your guns. That will help you maintain your confidence. Also, when you made that plan back, few months back, you would have thought about something when you made that plan of the last 1 to 2 weeks. So stick to that. However, if it's your first attempt, then maybe you can take this video and the strategies I tell you with a little bit more of a weightage, and think about doing what I'm going to tell you, right? So firstly, revision cycles. So last 1 week to 10 days, you have to do at least one cycle. 1 week one cycle is excellent. And again, I understand that there is a lot of syllabus, and saying it is easier said than done, that last 1 week do one cycle, because obviously we know how many units are there, how many sub chapters are there in those units, how many topics are there in those chapters. It's a lot. But again, it was you should have already filtered down, funneled down those things into your last 10 to 15 days where you would do that final cycle, especially that last half cycle, right, which has the most volatile of the volatile things. Or even a notebook which you might have made, like there's a thing called 20th notebook that goes on in NEET PG, right? That is after the 19 subjects, there's a 20th notebook containing the most volatile information. If you have made something like that, that is also excellent for the last couple of days or more, right? So that is the material that you should focus on, apart from your one cycle of revision through the last 10 days, right? Apart from that, how to plan these last days, right? So for that, you can use something called weighted scoring, right? So in weighted scoring, what you do is basically you look at two things to kind of give a weightage to a particular topic. So what are the two things? One is how volatile it is, and the other is how important it is. Importance comes from how frequently, how prevalent is that in the PYQ, right? So based on two things, that is the volatility and the importance or the prevalence in the PYQs, you give weightage to topics. So firstly, you give the weightage to units. Obviously you can't break everything down into small topics and then plan your study. That will take a lot of time. If you've done that, fair enough. But otherwise, you can just firstly use this weighted scoring for units, and keep the ones that are getting the highest score, that is highest prevalence, that is highest importance, and the highest volatility, to the last days. Maybe not the last day, because last day you might want to keep it, some one part of it will be to keep the last day as a grace period, because you would want to finish at the sixth day, or penultimate day, and still something will be left that will get pushed on to the last day. Plus you might have some other small things, like a small notebook or something, like a small saved folder images, something like that, that you have kept for the last day. So last day, or even if not the last day, at least the last half day, you have to keep as grace. Apart from that, use this weighted scoring and give scores to each of the units, and based on that you plan your next 7 days. So again, this is for those who are planning it now. If you already have made a plan, it would have been great if you have done this way. Otherwise, also stick to your plan, right? So apart from this, you have to keep in mind your previous year questions, especially the ones that are in your NEET SS questions, especially the ones that have been discussed in the last couple of years or so. I hope you have all the material in terms of the video discussions, in terms of, I think, one 2022 PDF I have shared in the group as well. If you want that, I'll share it again. So that those particular PYQs also you have to add in these last 7 days. And
Uh-huh.
what do I mean by PYQs? Just a second.
Yep. Continuation. Sorry.
Acha, yeah. So Aditya has joined. I didn't.
Yeah.
Yeah. So what do I mean by PYQs? At least just the question and answer. Don't go to the topic. Don't read the topic in depth. Obviously, you don't have the time for that. Only the question and the just the question
Get,
and the
getting a PYQ wrong is a sin, let's put it this way.
yeah.
Right, because the truth is that if you get a PYQ wrong, there is someone else who is not getting it wrong. It's not that they will push your rank to something really high, because the paper is very conceptual, to be very honest. NEET SS, if I go by the last two paper strengths, it's not something which is very tough. And even if you have, it's more since the pattern has changed, instead of subspecialty wise, when it has become broad specialty focus, the depth has gone down and the width has increased, right? The breadth has increased rather than the depth. So even if you have decentish knowledge, not like very deep knowledge, but decentish knowledge of every system, you will be fine. You'll actually be fine, right? You don't need to know, pediatric cardiology in depth. You don't need to know everything in pediatric oncology in depth, right? But but the basic things, which are in fact, for that matter, even I would go on to say, which are even important for NEET PG also, right? If that much knowledge is there for most of the subjects, for most of the subspecialties, you will be fine. Like for example, TLS is something which they are asking again and again. Right. And similarly, most commons here and there do get asked here and there, especially as far as genetics and is concerned. So what Vishnu is saying is that as far as the PYQs are concerned, that you can't get them wrong. So just ensure that last 1 2 year papers you have on your tips. Even if you don't understand a particular topic, that's fine. But at least that particular MCQ, you should know, if it just gets repeated, you just mark it and you move on.
Yeah, like NEET SS is sometimes called as NEET PG plus plus, right? It's
Yeah.
just an extension to your NEET PG. That's a separate thing, that in NEET PG we don't read pediatrics as much, like across
Hmm.
it, and we kind of read it from pathology a bit, from medicine a bit.
Medicine
But
and all,
yeah,
yeah.
it's if you read your Ghai well, that itself covers a major chunk of your NEET SS prep as well, and that's how we went about making our videos as well. If you look at it, it's not in depth, and it's not going into that INSS realm. And that is how the exam will be, and that is how you have to think about your
Prepare
preparation,
also.
and also go into the exam thinking about it like, I don't have to get all 150 right, and also the questions are going to be just ahead of what I've read through my MBBS
Mm.
years, right? So go with that confidence, and also
I think
plan
we
your
will,
last week like that
towards
as
the
well.
last, we'll also say the things Vishnu has put it to in the last slide also, that it's not the end of the world. One reason why NEET SS, you can always give NEET SS with the peace of mind. So you have to understand this, that uh, the degree that you have, the MD and DNB in pediatrics, it's good enough. It's genuinely a really good degree, to be very honest. Right? Like even if, let's say, this doesn't, like, you don't shine through, for example, like let's imagine the worst case scenario, what's going to happen. You don't get a seat. So you still have that huge MD pediatrics degree, which is always going to carry you towards, right? Malab, this is just obviously SS and DM and NICU, PICU. Obviously, these are or pediatric oncology, or for that matter, model. Or they're good to have. I'm not saying they're not good. They're good to have. They're great to have. They do push your career forward. They do open up a little bit of opportunities. No doubt about that. But the MD pediatric itself is amazing to have, I would say. You all are pediatricians and nothing can take away that fact, right? And unlike NEET PG, where where you always had that thing, if I don't get through a specialization, I'll just be an MBB, just be an MBBS. Your opportunities are limited. That's not the case as far as NEET SS is concerned. Here, if you do get through, sure, your opportunities do increase. But MD Peds in itself has a lot of opportunities. So that should always give you the confidence that even if it doesn't go according to my plan, you should be more, you should be very, let's put it this way. हिंदी में क्या कहते हैं उसका आई एम एबल टू थिंक ऑफ द हिंदी वर्ड मे बी विष्णु कैन हेल्प मी फाइंड द इंग्लिश वर्ड बुलंद होके जाना है लाइक वेरी निडर
Like,
होके जाना है
with
या
go in with all the confidence and like
yeah
with
exactly मतलब just like how Katy Perry used to say it in a video I'm gonna roar right you're
yeah.
a lion or you're a tiger like तुम हो pediatrician यार nothing can take away that from you right you are a pediatrician and every person I just had a kid still I would need a pediatrician I'll be very honest right that despite so you're always that's always going to be there so don't be fearful of the paper attempt it with a fearless mindset and because when you attempt it with a fearless mindset the scores do improve.
Yeah, and also like I was also about to add another thing. Yeah, we'll come to it at the end about how
Mhm.
what to do on the last day. And yeah, so let's
Mhm.
yeah, we got done with what I told you about the weighted scoring.
Mhm.
Whatever is getting a lesser score, do it right away, and whatever
Mhm.
is getting a more score in terms of volatility and importance, do it little bit at the end, right? And also through the day as well. Sometimes what happens is we plan to read a certain topic and a certain unit, and then we start to read and we read unimportant topics, and by the time the day ends we don't have time for important topics. So always keep this in mind as well, especially through the last week, that finish off the important topics through that day whenever you're doing, for example, uh, you know
Again emphasizing that the breadth is more important
yeah.
than depth, right? You might feel, for example, you all have given INISS as of now, so a lot of you might have your favorite topics. Like let's say you gave peds onc, or let's say you gave pediatric neurology, or let's say you gave NICU. So you'll always have that particular topic, but you have to understand at the end of the day, if you look at the percentages of question from each particular subspecialty or each particular system, the difference was not too matlab, there was no significant difference. Let's say there were 10 questions from oncology, then there were maybe 15 questions from neonatology, or maybe 14 questions from cardiology, if I'm not wrong, last paper, if I'm not wrong. So it isn't that like you like cardiology and you are keeping on doing cardiology and 30 questions will come from cardiology. No, it's not going to happen like that. So if you just go too much in depth in let's say cardiology, you are missing out on easy questions on oncology. So your goal in the last 7 days should be to cover as much as breadth rather than going in depth. It is, you have to understand, there's a fundamental difference between NEET SS and INISS. NEET SS is not INISS of 10 subspecialties. NEET SS is not the in-depth INISS of 10 subspecialties together. No, it is the
Is the
suppose you,
general medicine part
yeah,
of
yeah,
INISS, that is across,
across all
it's
the
into
general
150
yeah, the general
questions.
pediatrics part cut across, not the general pediatrics, but yeah, basically, let's say if INSS requires 10x depth, you probably just need 2x or 3x of depth for each subspecialty here, and with the major portion being general pediatrics, a decent portion, if not major, a decent portion still being general pediatrics. So don't and it's very common and it's human nature, right? You like that particular subspecialty, you like and you're good at it, so you will it will kind of, you'll keep on doing your although unnecessary but positive reinforcement. I am good at it, I'll let me keep on doing, oh, more in depth, maybe something is asked and something like, no, it's better that if you're good at something, finish it fast, move on to the next subspecialty. And the goal should be that in the 7 days you should, there's a very important term I like to use even for NEET PG, for that part, for every exam. By the end of these 7 weeks, when you're in the exam, when you're going for the exam, NEET SS, you should have a sense of completion. Completion is not important. I'm not saying that you should be complete, your syllabus should be complete, but no, but there's a sense of completion should be there. That broadly I have touched upon everything. And that sense of completion will give you the confidence to, be a little more vigorous as far as again attempting the exam is concerned. You'll be a little more risk taking and, that, okay, I have done cardio. Well, like for example, I'll give you an example. Like, let's say you go too much in depth in neonatology and you forget to do oncology, right? Versus someone who didn't go too much in depth in oncology and in neonatology and did a little bit of oncology as well. Now, let's say the oncology question is not a tough question. The oncology question, you're someone who's preparing for neonatology, and oncology question is not a tough question. If you have not revised oncology even a bit, let's say in the last 7 days, again, this is just an example, even if the question is easy, you will feel scared to attempt it. You will feel that okay, you had not revised whether you are going on the right direction or not, right? Even the simpler questions like TLS, for example, is very easy. We all know calcium goes down, rest everything goes up. But just this thing, the simple thing, that potassium, phosphorus, and uric acid, all these three things are going up. This simple thing might feel a
Even
little
even if you actually know, you might hesitate because of the
hesitate in exactly
underconfidence that you
exactly
didn't
exactly
revise.
yeah, because you didn't revise. So focus more on the breadth as far as in versus the depth in terms. And we all know we have our favorite topics, but don't for NEET SS you'll be at a loss. Frankly, you'll be at a loss. Try to cover the breadth even if the depth gets compromised a little bit.
Yeah, definitely. And this slide is for those who are giving this exam for you know the first time, or people who are not feeling like reading because they've got something in the INSS. So this is also there. These students have also been messaging me, and I always tell them, if you're not reading at all, if you are still confused and you want to give this exam to an extent, complete the videos once, go through the videos, because that is almost like a passive reading. And that, trust me, I've done this for my own INSS as well, because I had done my NEET essays, I had cleared my NEET essays with a decentish rank, and I was really not feeling like reading through the last 2 weeks, 2 3 weeks, or something like that. And I went through the videos again and again, 1.5x. I went through them twice, and even I never,
Use it like Netflix, I would
yeah,
say.
something like that, just even like YouTube, yeah, put it at
Hmm.
1.5x, try to see it once. Or maybe if you're very very confident with certain topics, whatever you are not with, you see them twice at 1.5x or so, right? You can attempt this again. If somebody is already in a very good prep, do not get into this. Go through whatever you are have
This
read
is
and
only for
revise.
people who are not feeling like giving the exam.
Yeah,
That at least something passively goes into their ears and into their minds.
yeah,
Because you have to understand that videos are a very passive form of learning. We think they're active, they're not. Videos are a very passive form of learning. For someone who wants to actively revise and give it NEET as the best shot, please, like it's a very simple request because just the word videos is here.
yeah.
You don't need to go through the videos. You really don't need to. You have your own set of notes. You have your PYQs. Please revise them actively by seeing it in your iPad or physical notes or whatever it is. Right? This videos is only for those people who have gotten a decent enough a rank in INSS, are reasonably confident that they'll get through INSS at least, don't feel like going for NEET SS, or someone who has just completed their MD or DNB examinations. They're giving NEET SS for just for the heck of it, and probably the next attempt or next year or the next INSS is going to be their first serious attempt. You can just passively go through the videos. Okay, chalo, like the way you put on the, like for example, when you're bored, what do? You put on the Netflix. Netflix keeps on playing some movie in the background, right? Like Netflix and chill. Or for example, as far as YouTube is concerned, sometimes you just put some YouTube video in the background. You keep on talking with your friends or your anything, something keeps on playing in the background and like that. So videos can be like that. If you're not in a mood to study, you can just put it in front of your laptop, let the videos, especially the PYQ videos or the QRP videos for that matter, the quick revision program videos that we have made, they can keep on going in the background. It is something you will keep on going on the exam day. You might recollect, you might not recollect, so on and so forth, right? It's a low effort, low effort task to have the videos out there in the background and you're just listening to them for that matter. Like a podcast, I would say. If you don't even want to watch the video, just turn on the video, put on the mic, and just listen to the video as a videos in 1.5x as a podcast. But this is not for, and this is very, very important. This is not for people who are actively preparing for the exam. You should actively revise your notes. You should actively revise the PYQs. You should not go into getting the videos. Right.
And
And this brings to the last day, obviously.
yeah, so last day, I think you might have had a notes which you prepared for the last day, or even saved PDFs, obviously, all of that. Plus your PYQs, again, only the answer and the question, not the topics. Then, if you have a list of repeated test errors which you have done 2 to 3 times. If you have a list of, say, again, 200, 250, that doesn't help again. If you have distilled it down, funneled it down to something that you're repeatedly getting wrong 3 times or so, then those you can use it and again quickly go through them. Not all of this should not entail more than 5 to 6 hours, right? And same with the tables as well. Sleep optimization, this is something that always used to haunt me, so I always would put that for everyone to just keep it in their head, that again, don't put pressure on yourself that you have to sleep or something. Just lie down and just feel that, okay, I'm giving my body physical rest, and that should put you to sleep most of the times. And on the exam day, please, at a rate of +4 -1, and this is something that all of our seniors always used to say, attempt all
If you
questions,
want to,
because
even if you want to leave, don't leave more than five.
yeah,
Well,
yeah,
I
like
know you should attempt all, but I know that if, when someone says attempt all, it feels like many attempts are थोड़ी ना हो सकते हैं like that.
yeah,
Like
I think one problem with what happens is when people come back from the exam, then they only look at these things, right? So they
negatives,
might
and
have,
they don't tend to forget
yeah,
the
they might
guesses
have
they
guessed
got right.
20 and they'll
Yeah,
get, they'll get both, but this is something that they'll forget because
this is
okay,
this
I
okay.
might have known it from somewhere, but
Yeah.
this is something that they'll remember. So that's
That's
not the
this
right
human
way.
psychology, it's been proven in human economics and human psychology that humans are more attuned to loss aversion
Yeah, yeah,
rather than
the
gain,
positive,
right?
possible
Exactly.
positive gains,
Like,
yeah,
let's say someone gives you 20 rupees and someone takes you 20 rupees, for example, right? The happiness of getting I'll reverse it actually. Someone gives you 100 rupees and someone takes 20 rupees from you. The happiness of getting 100 rupees is lesser as compared to someone taking away 20 rupees from you. The same psychology works here also. The reason, although the maths, the stats and the maths is very clear. If you attempt all, simply by the virtue of probability, you will get more marks. That's it. There is no doubt about that. Simply by the virtue of probability, you'll get more marks. And most of the times, you will not be taking blind guesses. I'm pretty sure you must be able to rule out one option. And if you're ruling out even in one option, and you're reasonably confident that the answer is in three, then there is absolutely no way you should leave that question. But it's the human psychology that we try to optimize not for a gain but for loss aversion. That's how human psychology works. Uh, Curb it. Try to be a little more aggressive in your approach. It is going to matter. See, you have to understand that on an actual exam day, how many questions, even if you're like really, really thorough, how many questions will you be, confident in out of 150? You will probably be confident in 100, maybe 110 questions. If you're just confident 100, questions and you're just attempting 110 questions, you won't clear because the cutoff last year's went up to 120 corrects, 120, 125 corrects,
yeah,
basically. So the reason people are getting 120, 125 corrects is not because they knew 120 questions correct, they knew 100 only correct. They guessed the rest of the 50 questions correct after ruling out one options, and that brings about to the 33% probability, which is around 15, 17 marks, and that's how they got to 120 marks basically. That's how every exam functions as far as any competitive exam is concerned. So you have to attempt all questions, even if you feel like I don't know anything about this particular question, I have no idea about any options whatsoever, which is not going to happen. You have done your MD pediatrics and DNB, right? So I'm pretty sure it's not going to happen. But even if you feel like that, please don't leave more than five or maybe six questions. Like that's the maximum I would say. Even
yeah.
if
I
you're
mean, I've seen that when I tell five, students end up leaving 10,
leaving 10,
15.
don't do
So
that. Don't give 10, 10, 15. Matlab, like what happens is
especially in +4 -1.
yeah, when you leave 10, you're essentially reducing your chance. Let's put it this way. In five, maybe you are not. Maybe you are actually optimizing for loss aversion, and
Yeah,
fine,
possibly, yeah,
possibly that's always a possibility. But when you start leaving 10, or if not 10, maybe 15, then you are essentially losing marks on the table which you could have gotten correct. See, if you leave 15, you're optimizing for not getting -5, sorry, -15 basically, right? But the truth is that even if you got
even
like
if you
three,
randomly
if you
mark, you
even if
will
you
get
if even
four.
if you get three questions correct,
Yeah,
even if you
then
got three
even, yeah,
questions correct, you would
then
not have
also
done
you're in
anything.
plus. Yeah,
Exactly, exactly. Even then, also you're in no loss, no negative. Like if three, like so that's the thing. Don't like 15 is don't leave 15 questions. Plain and simple. Plain and simple. Don't leave 15 questions. Right. Don't leave 15 questions. Right. Maximum I would say is five or six. Uh, up to, like, see, we say up to 10, you will leave 20. That's the problem. So
Yeah.
we will say just leave 5. Don't leave more than 5.
And also, yeah, most importantly, like as we dwelled upon it for a decent amount of time, it's not the end of the world exam. You
Hmm.
firstly, yeah, you have a great degree, which especially as pediatricians, there's no compulsion per se in the real world to, do go for a super specialty. It's something that you're doing for a little bit of more, advantage plus your own interest, right? Because you're giving your 3 to even sometimes 5 years in this particular process. So it's something that as Aditya said, give the exam, and also your preparation should be that way that you should enjoy reading that. Okay, you're not only giving the exam but also becoming a better pediatrician through this phase, right? So read like that and give the exam like that. It's definitely not a
It's
do
not
or
do
die.
and
And
if you don't if you attempt it as do and die, I would say the anxiety will get the better of you.
exactly, especially through the maybe 3-4 months before you're thinking it's a do or die, and you're bringing in the motivation that makes sense. But on the last few days, you're anyway reading how much ever you have to read, because motivation is not the main issue at that point of time. And it's much better to think about it in a much more positive way and a cool
And
way
I
to
would
keep
I would say one
your
more
calm.
thing. After the exam is done, ensure that you get wasted on and go and party a lot. Okay, like if you drink, again, just kidding, right? But my point is, you have earned it, right? You guys are already making decent amount of money. I'm pretty sure you must be doing SR ship, or you must join SR ship or anything. So you deserve that one day. You deserve
Yeah.
that one day. You must have be having a significant other. You might be married, or you might be having a really good set of friends and everything. You deserve on that day, go watch Dhurandhar, go watch whichever movie, like whichever is the talk of the town, maybe like 1 week later or whatever it is. Drink your guts out, or even if like this is not you're a very big introvert, just put on your blanket, watch. Stranger Things would have come. You would not have watched, right? The final 4 episodes of Stranger Things would have come. Watch Stranger Things, like enjoy, right? Like being very honest, the tough part of medicine is already done. The MBBS and MD is usually the tough part. These are bonuses, I would say. Good bonuses. I'm not going to deny they are not. They do make they do make your life in terms of financial or in terms of in general respect or whatever it is. They do make it better, right? They do make the life better. But the tougher journey has already been done, and you have conquered it. Already done. You're done with I would say you're done with not with two, you're done with 3 exams. Getting into MBBS, the MBBS exit exam itself, I would say, is a tough one. And the entrance, the NEET PG one is also a tough one. And even I would say even the MD exit exam is not also an easy one, to be very honest. You're done with the tougher parts of the journey, to be very honest. This is just these are like boosters rather than the main engines. These are enzymes and catalysts for growth rather than the actual chemical reaction. So enjoy on that last day. That's a very genuine advice, because if you enjoy on the last after giving the exam, and let's say if exam doesn't go well, and you're wanting to prepare again, you will also be in a much more fresher state of mind, to be very honest, right? That okay, fine, I took my 1 week off, my 10 days off, or 15 days off. So enjoy, like a very genuine advice. Please enjoy. Life is meant to be enjoyed. Life is meant to have fun. So don't compromise that after the exam is done. Goes without saying, no, don't start enjoying 1 week into the exam.
Yeah, I'm thinking about that day when you will have that
Yeah,
enjoyment, also pushes you more a little bit through this
exactly.
week, and also keeps you in a very positive frame of
Positive,
mind,
right?
that
Like,
it's not all doom. Sometimes you go into
yeah.
that doom state during those phase of exams. So
The last, last,
sometime through the day, just keep thinking of that day of when the exam will be over.
exactly. Exactly. It can serve as a motivation also. Like, you know what happens like 3 or 4 days just before the exam? It just might seem okay. You might have revised 2, 3 times. It might just get boring, and you might feel lack of motivation. Just thinking about okay, exam din ke baad main party karunga ya party karungi, whatever it is, might just serve as that internal self motivator to push you. कि
Yeah,
चल 3 दिन ही तो और बाकी हैं. Like
let's give it my all. Yeah.
so my mother-in-law used to say this, like, beta चूहा निकल गया है, पूंछ रह गई है. So it is almost like that. Like the mouse is out of mouse is out. This is the tail is left. This last 7 days are like that. Just push through it. Use whatever self motivator or external motivator you have, and uh, you will be cracking it and going to the finish line and everything. That's it.
So on that positive note,
Let's
let's
do
do
this.
this. Let's go through this last 1 week together, and I'll just go through any doubts if something's there on our YouTube live, and obviously if anything else, we are always available on the top as well. Yeah. Yeah, so the PDF thing, I'll just go through where I had posted, and I'll put the PDF on the group right away on a group,
I'll just see if
right? So
anything else. Vishnu, I
no,
also
no,
have.
I think this was the only doubt that was there.
Sure.
Anything else, obviously, you can put it on our group, or we're always our numbers are there on the group, so you can DM us as well, right?
Sure. All the best.
Okay, all the best. Thank you so much.